Well, news tonight, that massive Salmonella peanut recall is expanded.
Yeah, more people are getting sick out there. Dozens of people have fallen ill across 19 states, and the list of contaminated products is now 10 pages long, containing more than 400 peanut products, including ice cream, peanut butter, and moon pies.
I had eaten peanut butter like 3 days in a row, and I just got so sick.
Now, the CDC has now traced that contamination to a factory in New Mexico called Sunland. The FDA is warning consumers not to eat any products associated with Sunland. And keep in mind, some of those foods are sold at Trader Joe's, Whole Foods, Target, Walmart, and Costco. Joining us live right now from West Penn Hospital is Dr. Bruce Macleod, Vice President of Emergency Medicine there. And Dr. Macleod, first of all, why is this outbreak so serious?
Well, this one's so serious, Wendy, is because it's so widespread. Rarely do we have salmonella outbreaks that cross 38 states. I think it's because of the distribution of the peanut butter. I think that also if you talk to the patients or hear their stories, they're having a lot of nausea, vomiting, abdominal pain, and diarrhea.
Well, and now here's an important question. How do you differentiate the effects from salmonella from like the common cold, maybe even the flu? How do people know they have it?
That's a good question, and I would say that it has to do with how long you have the symptoms. Typically, when you have the flu, there's more than just the abdominal symptoms. You're going to have runny nose and coughing and earache and other symptoms like that. Salmonella is primarily a gastrointestinal disease. It also lasts for an extended period of time, and typically they have more bloating and abdominal pain.
All right, and we do now have a question for you from one of our Facebook fans. Marianne Hodge-Tony wants to know if there's anything pregnant women in specific here should do differently. Should they take extra precautions, stay away from peanut-based things altogether if they can?
I think I would suggest that she follows the instructions of the CDC. They've isolated where this salmonella outbreak has originated from. I don't think that we have to have widespread panic and throw the peanut butter industry into chaos. I think it's just one factory that's at source there. So just be sure that she knows where she gets her peanut butter products.
All right, before I let you go, one of the tip-offs to let people know, hey, this might be something you need to talk to your doctor about, what would you say?
I'm sorry, Wendy?
One more thing, if I have one more question for you, if you had to say to somebody at home who feel like they're worried, they're thinking maybe I'm sick with this, what would you encourage them to do to talk to their doctor if they think perhaps they might have this poisoning?
Sure, I would actually call your doctor. If you have any concerns, call your doctor and relay to them what symptoms you're having. There is some testing that we can do to identify salmonella, and we can certainly help modify the symptoms as well. So if you have concerns, give your doctor or healthcare provider a call.
Well, we so appreciate your expertise, Dr. Bruce Macleod from West Penn Hospital. We appreciate that. Thank you.
Thank you, Wendy.